Hey, Dr. Bob here with Active Life Chiropractic, and I just want to give you a crash course on disc herniations. So I want to show you what the disc is, how it herniates, what are the symptoms, and then I want to go through and show you treatments in terms of, the conservative types of care all the way through aggressive surgical types of care. But when we look at a disc, first off, to show you what this is, so the disc is the space that's in between two vertebrae. So your spine's lined, it's vertebrae that sit one on top of another from your neck all the way down to your lower back. These are the bones, and then in between each bone is the disc. And then coming off in between these two bones is going to be the nerve that comes off on each side, and it connects and controls some part of your body. Now, if you think of the disc, I always compare them to a jelly donut, because if you think of a jelly donut, it has this outside exterior to it, and then it's filled with jelly. And the best donuts are the ones that are nice and thick and have a lot of jelly in them. So the first bite that you take has jelly. You're not having to take like 6 bites to get to the jelly. That's what you want for your discs. You want there to be a lot of fluid in there, which is what it's made up of, and you want the outside to have integrity to it also. You want it to be, you don't want it to be stiff, but you want it to be strong. You want it to be tough. That's a good disc. So you want it to be nice and thick. So if you think of somebody that has arthritic changes to their spine, typically it's somebody that the disc doesn't look like this. It's going to be smaller, and they're going to have not as much mobility because the disc is smaller. There's not as much fluid in it. It serves as a shock absorber to your spine, but it allows your body to move around. And then somebody with arthritis is going to lose mobility. So we want the disc to be nice and thick and healthy. Now, what a disc herniation is, or a slip disc, or a disc bulge or disc protrusion, depending on who you see, they're diagnosed different ways and called different things. But the disc is going to start to slide out of place, and then it's going to put pressure on that nerve. So you'll see, instead of the nice thick jelly donut that has equal symmetry from side to side, everything is being pushed off to this way, hits the nerve, and then that causes your pain. And the pain varies from person to person. You might have someone that has a disc herniation and it just started, and they're just starting to get a little bit of pressure on the nerve, and they'll tell me it's like a 2 or a 3 out of 10 if 10 is the worst pain you've ever felt. Somebody else might have it full blown, the disc is sitting on top of the nerve, and it's a 10 out of 10. And I mean, women that have gone through childbirth will say that this is the same level of pain that they had, delivering their baby. So it's pretty intense. And to make matters worse, wherever that nerve goes and whatever controls will be affected too. So if that's the nerve in your neck, it runs down into your shoulder, arm, and your hand. You'll start noticing pain that radiates down into your hand. It's often that somebody will notice numbness, tingling, pins and needles. They'll notice muscle weakness, but they'll have this excruciating, achy pain that just doesn't go away. It's hard to get comfortable. It's typically hard to sleep at night. If that's going down into your leg, if that nerve travels down, it'll go all the way down into your foot. And somebody will be like, it's so excruciating, there's nothing I can do to get it comfortable. People will say, I wish I could just cut my leg off so the pain would go away. So they can be pretty intense. The way that these discs actually herniate and slide out of place, there's a couple different ways. So first off, there's the trauma aspect of it. And this would be, what you would typically think of when you think of a disc herniation. So it compresses, and something causes your spine to be compressed. So if you fell off a ladder and landed on your head, it's going to compress your spine, and the disc is going to spew out onto the nerve. If you got hit over the head, if you fell straight down, and it compresses your lower back and your lumbar spine. These are things that will cause that. And I would imagine if you went back to the hunter and gatherer days, when humans had to find their own food and catch it, and were outside and very active, would sustain way more traumas than they do nowadays, you would see these types of traumas to their spine that would herniate the disc. But nowadays, it's still common to see traumas to a spine that causes the disc problem, but it's more so comes from a sedentary lifestyle. Now, when I say a sedentary lifestyle, I'm not saying that we're all lazy. I'm just saying the way our society is set up. Nowadays, you don't even have to go to the grocery store to get your groceries. You can order them and pick them up at the curb, or they can deliver them to your house. We have phones that gives us access to information immediately. Our society is very convenient, and we don't move around as much as we used to, which is great, but it's not very good for your spine. And then when you combine throwing in, most people have computer jobs where we're sitting at a desk, sitting over a computer 8 hours a day, not getting movement into your spine compresses these discs. And as time goes on, we're pushing the jelly out, and eventually it's going to hit the nerve, and that's going to cause the problems. So the trauma aspect would be a slip, a fall, something traumatic to your spine that causes it to herniate immediately, whereas the lack of movement that causes it, sits in as years and years go by. So movement is going to be key for discs and preventing them from getting worse. That's why we always say exercise, movement, walking. There's countless reasons of why it's good for you, but for your spine, this is the biggest reason. Now, how chiropractic care helps with disc herniations. Chiropractic is definitely considered one of the more conservative approaches to disc problems, but it comes down to the alignment of your spine. So, if your vertebrae are not sitting one on top of another, if they're not completely vertical, if they have this shift to them as opposed to this one, so this is what you'd want to see. You want the spine to be completely vertical, and you put equal pressure on the left and right sides of the disc as opposed to this one. Gravity is going to compress it and it's going to shoot off this way. So the way we treat this is if we start to realign the spine, we create this more vertical approach to your spine. You're balanced 50-50 from left to right, and you get pressure off of this nerve. And there's different degrees to how much you can help that. If this disc is all the way down here from the alignment being a problem, it's going to be a little bit more difficult to treat it as opposed to if it just started to happen. Like I said, it's the sedentary lifestyle that causes these problems, and if you throw an alignment issue on top of it, it makes it a lot worse. So, talking about these types of conservative treatments, chiropractic care is definitely on the conservative aspect of this. I kind of throw in, medications, over-the-counter medications like ibuprofen, Tylenol, things like that are anti-inflammatory. Somebody might take for this. If you go to a primary care, an orthopedist, a neurosurgeon, someone like that, they can prescribe steroids, anti-inflammatories, muscle relaxers that help reduce inflammation in this area also. They can do injections. You can do therapy, like physical therapy. There's what's called decompression therapy. It's trying to separate your spine, trying to get pressure off of it. Somebody will come in my office with a herniation and they'll say, I just feel like if somebody would just pull my spine apart, it would feel really, really good. Alignment does that. When you change the alignment, it actually starts to decompress the spine. But decompression therapy by itself will actually separate the bones themselves. It's a machine that you're laying on and it's actually stretching your spine. And then surgery would be usually a last resort. So like on surgeries, they might go in and they'll just cut the disc off. They'll shave it off is what they call it. So they'll shave the disc off of this nerve. These are usually outpatient surgeries, so they're pretty quick. The more aggressive surgeries are when they're actually cutting the disc out and they'll put brackets and screws. They'll put hardware. So they'll fuse the bones together. So they'll take the disc out and make two vertebrae, one vertebrae. Way more intense. Those are way longer recoveries because they're actually putting hardware into your spine. So that's always a last resort. And even then, that's usually somebody that's been suffering with a disc herniation for a very, very long time, and they've gone through the gamut of conservative therapies before they actually got to this approach. So hopefully you got some great information from this video. If you feel like you might have a disc herniation and want to get it checked out, feel free to schedule an appointment at our office. And my examination would show me if I believe that you have a disc herniation, and sometimes there are diagnostic tests that are needed to diagnose the disc herniation. So if you feel like you have one, give me a call, set up an appointment in our office, let me check you out. I can usually let you know up front if I can help. I can show recommendations. If I can't help, I can refer you to someone that can. For more health tips, strategies, and random facts about us, follow us on Facebook, YouTube, and Instagram.